This rhesus disease is a typical example of the quote, prevention is better than cure. And when you know, you know. Hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. Thank you so much for clicking to watch today's video. You're highly appreciated, and I'm always excited to be here. Today we are continuing with our pregnancy care series. We are looking at the various complications or special circumstances that may impact on a woman's pregnancy, her unborn child or her newborn child. And if you have not been following, I have done 2 previous videos on this series. The first one being hypertension in pregnancy, and the last one being diabetes in pregnancy, which is known as gestational diabetes. If you have not seen these videos, I will encourage you to check them out on JulieCity channel page and watch them. You find them really informative. If you're involved in a pregnancy, or you know someone that is pregnant, or for knowledge sake, we agree on this channel that knowledge is power and our health is our wealth. So in today's video, we are going to be looking at the Rhesus disease. I'll put it on the screen, the Rhesus disease. This Rhesus disease happens when a woman's antibodies begins to attack the unborn child or the newly born child's red blood cells and destroy them. I will avoid a lot of terminologies and keep this as simple as possible. So basically, we all have blood groups. So A, B, AB, and O. At the beginning of pregnancy, we encourage people to go in for their booking appointment, which is your first and most important appointment in pregnancy, as early as possible. And at this booking appointment, a lot of investigations, bloods are taken, questions are asked. And one of the bloods that is taken is to check your blood type and your rhesus factor. So if it is a blood type A, B, AB, or O, that is fine. But then we are looking for the rhesus factor, which can be either positive or negative. When it is positive, it definitely means that the woman has a blood type that has an extra protein on the surface. And when it is negative, it means that that woman's blood cells does not have that extra layer of protein. All it means that there is care that needs to be taken during pregnancy. So I will always say, please don't fret. Pregnancies do not need worries and stress. If a woman that has a rhesus negative blood type is identified, what happens is later in pregnancy, somewhere around 28 weeks to 30 weeks of pregnancy, the woman is encouraged to take the anti-D injection. If a woman that has a rhesus negative factor blood happens to carry a child in her womb that is rhesus positive, as a result of the fact that the father of that child is positive, and there's a 50% chance of that child being positive, and the mother is rhesus negative, what happens is that if for any reason there is a small mix in the blood through the placenta, what happens is that the woman's body recognizes that strange, unusual positive blood as danger. And as our body has been wired, we'll seek to protect the woman and develop a fighting weapon, which is what we know as antibodies, in order to prepare for attack for any exposure. However, this might take some time, which will protect this unborn baby, present unborn baby, positive baby. However, in subsequent pregnancies, if this woman happens to carry another rhesus positive baby, what her body will do then is to attack, because it's prepared, it's been sensitized previously, if no treatment is in place. This attack is what we call the Rhesus disease. The impact of this Rhesus disease, or the attack by the woman's antibodies, might start while the baby is still unborn, still in utero, or following birth. And some of the symptoms you will get to know is that the baby in the womb or this newborn baby becomes anemic. The other thing is that the woman's red blood cell or immune antibodies will end up trying to destroy this unborn baby or newborn baby's blood, and that will lead this baby to have what we call jaundice, and this might most likely be a severe version of it. In a severe case, it can lead to unaliving of a newborn baby, or the baby will come out unalive or still. Like any other disease, the Rhesus disease can be mild or severe. No one can tell whether, if left untreated, it will be mild or severe. So it's important to take action early. If a woman attends her booking appointments and her bloods are done, whether she is positive or negative will be identified on time. Because of resources and the fact that some countries might not be exposed to all the advanced technology in trying to figure all of this out, it is given as prophylaxis or as a form of prevention. A woman that is Rhesus negative will be offered this anti-D injection at about 28 to 30 weeks of pregnancy, and if required, following birth. And with this, the woman's red blood cells will be coated with what it is lacking and prevent it from developing the antibodies that will cause harm to her unborn child. Like I mentioned earlier, some of the dangers can be severe or mild. You don't know. So I said it can cause unborn child to become anemic or the newly born child to become anemic. It can cause what we know as jaundice, newborn jaundice, which comes with a lot of complications. When we get to the postnatal series, I'm going to be covering all about the newborn jaundice. So watch out for that. And the worst case scenario will be stillbirth. Remember that pregnancy is yours and it is yours to protect and keep. The midwives, the obstetrician doctors are there to support, to guide, and to help us take the right decision. But the ultimate decision will always come from you. Get your antenatal visits in, go for your regular antenatal appointments and any other arising appointments, educate yourself, go for antenatal courses, classes, get yourself equipped, get yourself in a place where you know that whatever decision you take is informed, not them say, thereby saving the baby and protecting the baby from harm, and also saving the parents of all the trauma and stress that will come from having a stillbirth or a very sick child and ending up in the special care baby unit, which is not what we want in the first place. What we want is a healthy baby, happy mama, happy baby. And that makes midwives happy, makes obstetricians happy, believe it or not, and everyone is happy. It is a preventable disease, and all you need to do is to get informed and do what is needful. Now, particularly with the Rhesus disease, it impacts more on the baby rather than the mother. If you're not informed, like I said in my previous video, where you are supposed to say yes, you end up saying no. And where you're supposed to say no, you end up saying yes. And that is why I have chosen to do this series, in order to throw light on life-saving procedures and decisions like this. I hope you found this useful. If you have more questions, I always love to hear from you in the comment section. So do well to leave your comments, experiences. Let me know in the comment section. And if you're a medical practitioner or a midwife, please educate us more in the comment section. Use the comment section as your platform to educate and enlighten us. I'm always keen to learn. If you have not subscribed, then this is the time for you to click on the red subscribe button and the notification bell. That's where you get notifications for all my uploads as soon as they arrive. And one more thing, please give me a thumbs up if you found this video useful and you like what you see and you want to hear more. Just click on that thumbs up button. Until I see you next time, don't forget, your health is your wealth. Bye. Remember to click on these videos that are popping up. You find them useful and informative, I assure you. Till I see you next time. Bye-bye.